My name is Stephanie Lankos. I am not Donna, as it says. I'm filling in for Donna, who is at an AmeriCorps conference this week. I am one of the team leads for a positive approach to teen health, and I work on the peer-to-peer mentoring program and with the adjudicated youth from through the PATH Plus program. This meeting is recorded, just in case you didn't catch that when you signed in. And Angie is our speaker today, and I am going to go ahead and let her introduce herself. While she is doing that, please in the chat box put where you're from and your role, and that would be incredibly helpful just so we have an idea of who all we are working with today.
All right. Thank you very much for that, Stephanie, and I hope everyone can hear me okay. I am going to, Stephanie, could you give me screen sharing? Thank you.
There you go, Angie. That should work.
Awesome. Thank you for that. All right. Hopefully you can see my screen now, and we'll go ahead and get started. Let me get back to, okay. So we are going to talk a little bit about stress and adolescence, but I know that Stephanie had mentioned putting in the chat box kind of where you're coming from, who you are, and maybe what you do. So I'm going to kind of go through that just a little bit as I introduce myself a little bit more. Tobacco Educator and Prevention Coalition. So I used to be the facilitator for that program in Nebraska when I lived in Nebraska. So thanks for that, Carrie. That is a very interesting program. Looks like we have a school counselor, and I'll let other people put theirs in there as well. But I can go ahead and we will get started with me introducing myself. So my name is Angie Alphen, and I am located in Fayette, Missouri, which is right in the middle of Missouri. It's a very small town, and I have a passion for people in general. I started my professional career as an investigator for the children's advocacy group. Every state has a different name for it, but I was an investigator for Children's Division, and I was assigned by the governor to a meth task force where I worked with undercover law enforcement, doing a lot of removals of children is really what it came down to. How it would work is I would go out with law enforcement whenever they were doing a drug bust that that had children in the home, and I would sit with the children until law enforcement secured the home, and then I would either take the children to the hospital or take them to placement or secure the house enough that we could leave the children there. So that was my job for 12 years. And during that position, I started realizing that I was on the wrong side of the coin. Instead of being on the removal side, I wanted to be more on the helping side of what I felt would be therapy. So helping people with addictions, helping families talk to each other, helping families learn how to communicate with each other. And so I went back to get my master's in clinical counseling degree, which I received in 2016 from Central Methodist University here in Missouri. I have lived in Missouri most of my life, but my husband and I moved to Nebraska. And we lived in Nebraska. We went for a 1-year contract with his job, and we ended up staying for 16 years. So we lived in Nebraska the majority of the time my kids were growing up. And it was during that time that I really was involved with Children's Division and really wanting to get something done to help people before we got to that point. So we moved back to Missouri and in 2012, and I went back to school pretty immediately to get my clinical counseling degree. So shortly after I graduated with my master's degree, I began teaching at Central Methodist in the same program that I had just graduated from as an adjunct professor. And so I now have taught with them for about 6 years, and I teach marriage and family counseling, addictions, and oversee the clinical program in the master's program. And then I also teach psychology and sociology in the undergrad program. So I am very passionate about what I do. I try to educate myself as much as I can all the time, talking to people. And that's what kind of led me to Donna Golub. She and I talk a lot about the things that we both do, the passions that we have. And so that led us to come to talk to you guys today about stress and the effects that it has on adolescents. I am the proud grandma of 5 grandchildren, and I have been married to a wonderful man for about 37 years now, but not without a lot of stuff, right? So that's what comes with 5 grandchildren and a husband of that long. So I've learned a lot through experience, but I've also learned a lot through my education. And that's what I'm hoping to bring to you guys today. We are going to be talking about stress and adolescence. And so today is our first part where we're going to be discussing how and what hormones contribute to stress, and what is stress? What does it mean? And what is it that we need to know about it in order to help people, especially teens, through those parts of their life? And then we'll discuss the different ways that stress can affect our body and some of the things that we can do to help get that stress released. In May, I'm going to be coming back with part 2 of understanding some of the impacts that are placed on our teenagers and what we can do to help them embrace their imperfections, and how to control some unrealistic thoughts that a lot of teens have. And then we'll learn some simple stress management skills to help us help teenagers navigate through some tough parts of life. So that's kind of what it looks like for today, and then again in May. So hopefully you will reconnect with us and we can start reaching out to figure out some of the aspects of stress management that we want to help kiddos with. All right, so in order to really understand what stress is and how to work with kiddos with really high stress levels, we really have to begin by having a bigger and broader understanding of what stress really is. So understanding anything like that is what we want to do, enable ourselves to really work with them in a way that makes sense. We have a lot of research out there that gives us a lot of information about stress. And there are a lot of different components that we can attack. If we don't understand stress, though, we won't be able to really grasp what a kiddo needs when they need it in order to help them out. We're really just putting a Band-Aid on the issue if we don't get a better understanding for it. So that's what I hope to do today, is to get an understanding of what stress is. And so we're going to start off with the stress hormones. And when I talk about stress hormones, I'm really talking about this idea of a shower being turned on in our brain. We all have this shower in our brain, and we all have the ability to work with stress hormones or work against stress hormones. And so the more that we can really understand what the shower in our brain is, the better off we're going to be in addressing all of the symptoms of stress. So we're going to just talk about 3 stress hormones today. And I want to spend a little time just with these 3 main, I'm not going to say main, 3 big stress hormones that occur in our brains, specifically in teenagers, when that shower gets turned on. Because when we talk about how to address stress, then we have to remember that we have to learn how to turn that shower off a little bit in order to help control the stress hormones. So let's get started with adrenaline. And I'm looking real quick. I'm getting a 911 call. So let me just look really quick at what that is. So I'm not sure what it is. They'll text me if they need me. So, all right. So let's look at different stress hormones. And we're going to start off with adrenaline. And so adrenaline, and I'm going to go ahead and admit Deanna. I'm not sure, but that way they can join the session as well. Stephanie, if that's not something you wanted me to do, just you can have them leave the area. But okay, so adrenaline. Adrenaline is a hormone that most of us kind of enjoy. And this is directly related to many adolescents actually really want to have that adrenaline rush. And so what we know about the adrenaline rush is that it's something that we need to pay attention to, and we need to actually encourage it. I'm hoping I'm supposed to be letting these people in, but Stephanie, again, if I'm not, please take over that part of it. But so when an adolescent is looking for and wanting that rush, it's going to be really helpful if we can explain to that adolescent what is really happening in their brain. So when that adrenaline shower is turned on in our brain and adrenaline is released, it triggers a brain to release dopamine, which I always say that dopamine is the good dope. Okay, it's just an easy way to remember the name of dopamine. So when dopamine is released, that's what happens in our brain when adrenaline is released. And so what happens is after we get a big rush of adrenaline, it activates the dopamine, which is the good dope. That's the dope that everybody wants in our brain. And that's what makes us feel good. That's what gives everyone that rush. They talk about the adrenaline rush, and that's what they're talking about. That is that dopamine that's happening. And so typically after a dopamine or a adrenaline rush, we get this relaxing feeling that comes afterwards. And so it has a lot of purpose. It has a really lot of good purpose. And so people who are working with teens really need to be aware that kids are going to want that dopamine or that adrenaline rush. And if we identify that a kiddo is really acting like they need something and they're starting to get a little risky, the more that we can give them the opportunities to have these dopamine or adrenaline rushes, the better it is that they're going to probably feel afterwards. But being able to explain that to kids is really important. Now, this also causes a jump start in our body. So what that does is the adrenaline starts a lot of stuff happening in our body. And so some of that is it can also trigger feelings of lust. And we know that teenagers are full of that feeling. And so being able to explain to a teenager or an adolescent what is happening with their body is really going to be important. So what else does adrenaline do and where does it come from, right? So adrenaline is made up by the glands at the top of our kidneys. And so it has a lot of function that is something that we need to have in our body. It causes our heart to start beating a little bit faster. It also is directly responsible for a lot of how we distribute and store fat, which is important to know when we're working with teenagers. It also promotes a lot of healthy gastrointestinal function. So when we think about a person's system getting out of whack, we might want to look at how much adrenaline is it that they're doing. We have a lot of trouble with different functions of our body when we start storing up some of these hormones in improper ways. So adrenaline is one of the factors of that. It also gives your body odor and pubic hair, which is important to note, because what do we know that teenagers have a lot of things happening in their body? It usually comes with that body odor and a lot of things that happen when they're beginning to go into that metabolical state of puberty. And so adrenaline is a very important factor for that as well. It helps regulate the immune system, your blood pressure. It helps with metabolism and how we burn off fat. And it also helps with our stress response, which is one of the things that we are studying today, is how does stress affect us and what is it that's happening in our body when we become overly populated with different hormones. So this is a really important hormone when we talk about stress and what's going on with teenagers or adolescents' bodies when we look at stress response. Next, we're going to look at cortisol. So cortisol is produced in the same gland as adrenaline. And so that adrenal gland at the top of the kidneys, we have cortisol. Now, cortisol kind of gets a bad rap. Cortisol is usually known as one that we don't want to have happening very heavily. What we have to remember is that cortisol has a function. And so we're going to talk about this a little bit more when we talk about good stress versus bad stress, and the purpose of cortisol in that. But what we do know is that when cortisol comes into our body in a smaller amount, it has really good purpose for us. It's when it becomes overloaded in our body that we have negative results, okay? So it suppresses inflammation in our body's tissue. So it's going to be really important in our body and how our body releases a lot of inflammation. Cortisol is directly related to that. It also helps control metabolism, and it helps us metabolize things in our body. So we find a lot of cortisol in our muscles, in our fat, in our liver, different parts of our bones. And so it also helps regulate blood sugar. So it does have some very important functions. It, again, is the amount of cortisol that makes a difference. And then it also helps regulate our body's stress response as well as our sleep and wake cycle. So when the shower in our brain comes on, that releases some of these hormones, whether it's cortisol or our different types of hormones that we're going to work with, we have to think about what is it that can shut that down a little bit, or at certain times, we're going to need it to turn on even more. And so it's really important to remember that hormones are that shower in our brain that tells our body what to do next. It prepares us for something. And so that cortisol is really important as we're talking about stress. And here comes the different hormones for sexual functioning. Now, why do we talk about that when we talk about stress and teenagers? It is very important to give recognition to the different types of hormones that are surging through a person's body at any given time. So to ignore testosterone and estrogen would be a disservice to teenagers. We have to understand what those hormones are doing in a teenager's body in order to be able to help them regulate what is happening with them. So, testosterone is really important for bone and body fat distribution and bone mass. So, this is really the one of the hormones that helps build a lot of muscle and where that muscle is located in our body and where the strength comes from. Now, testosterone is very strong in male or children identified as male at birth have a higher testosterone level than females or identified females at birth. Now, what we know with testosterone is it comes with a lot of aggressive behavior. And typically that is because of the way that it's moving through our body, the amount of testosterone in our body. So I know all of you have heard the old saying, there's a lot of testosterone in this room right now. And that usually means that we're going to see a lot of that higher activity, a little more aggression. And so we have to acknowledge that that is happening in a lot of bodies in that early adolescent period. And that testosterone level fluctuates over time until the mid-20s when it starts to regulate itself a little bit more. So we have a wide range or a wide age group that testosterone directly affects. And we have to give it credit when we're starting to see that coming into our systems. And so it's also the hormone that regulates the sex drive, and it directly is beneficial on mood and energy levels. Now, a lot of people argue like beneficial. And so I want us to start thinking of these hormones as if, again, just like in the cortisol, if we have a small amount, it's different than if we have a very large amount of testosterone floating through at any given time. And this testosterone also has a direct link to our sense of well-being. Now, as males mature, their testosterone levels start to go down typically. And so what we see in elderly is that sometimes we have a lost sense of well-being, a lost sense of purpose. And so some people will say that this is when we have that midlife crisis, okay? And so sometimes when we start to see those moods change during that time, we want to send people to the doctor to have tests done to see if testosterone is something that we might need to look at to increase those levels, to help a person with their sense of well-being, and to really engage the person in the purpose of that testosterone in their bodies. But all of this starts out way before midlife crisis. And that's what we're talking about today, is really looking at testosterone as a bonus in our bodies as young teenagers. But when we look at stress response, the testosterone levels directly influence in that. So we also have to be looking at that effect as well. And then we move into estrogen, which is the female version of the testosterone. So it has a little bit different functioning for females. And again, these would be different levels depending on the age of the person. But it initiates a lot of those pubic hair, breast development, menstrual cycles. So estrogen plays a vital role in the enactment of puberty. So when we start to see the puberty beginning, we know that the estrogen hormone is being turned on in the brain pretty heavily. And so it has a direct role to those functions. It also plays a vital role in childbirth. And so being able to understand the hormonal cycle of teenagers all the way into childbearing years is really important. For a lot of kids who grew up on farms, the word estrogen is used a lot around when animals are giving birth. And so it was pretty funny the other day. My grandson came into the house and he said, Oma, which is what they call my grandkids call me. He said, Oma, we need some estrogen in the barn. And I said, you need estrogen in the barn? Okay, what do you need? And what he was saying was that there was a cow getting ready to calve and she was having trouble. And so his dad had mentioned her amount of estrogen maybe being low. And so he came into the house and wanted me to give him a bottle of estrogen to give to the cow. Now, we do have hormones that we give to our cattle to help in the childbirth field. But it was really cute that he brought up estrogen as what she needed. So it plays a vital role in birth and how our bodies are able to have children. But a lot of other hormones do that as well. Estrogen is just one of them. Estrogen also has a direct impact to our sleep patterns. And so this, again, is one of those things that we see take into play in adolescence and then also on the other side. So when women go through menopause, we see that sleep pattern, again, being upsetted. So when we look at it as an adolescent, we also know that adolescents go through a lot of hormonal changes that make them a little bit nocturnal, right? We know that teenagers like to stay up at night and they like to sleep in during the morning hours a lot of times. And so that's a struggle. What a teenager needs to understand is that they are not causing that always. They may play a part in that, but a lot of it is that hormonal changes that kids are going through. And so helping children understand that those hormones have been turned on and it's going to cause a lot of this stuff that's happening to their bodies is really important. Hair loss or thinning, also as teenagers begin moving into those ages of puberty, we see the hair patterns or the hair chemistry starting to change. Again, when we get to the other side of that cycle, as estrogen begins to decrease, we start to see the hair loss or the thinning of the hair in typically in women a little bit older or who have some medical conditions that might push them into menopause early. Estrogen can also contribute to depression. So again, the levels of estrogen that are found in the body have a direct impact on moods and the stabilization of moods. When we think about stress and teenagers, estrogen would be one that would cause some increases in some of these feelings because estrogen is directly related to the hormones that help us feel, which is why a lot of times you have teenagers who might cry a little bit more or might be a little more aggressive. My daughter used to say during puberty, when she first began puberty, that she would just feel this rage for no apparent reason. And so we know that all of these hormones are being released into her body at that age. And so her understanding that hormonally a lot of changes were happening was really important for her to understand what was happening with her body. So now we still don't know, right? It sounds like we have a lot of information about hormones, and we know that hormones are a good thing. So, what do we know about stress? And what do we know about how hormones affect us in the stress area? So I don't know how many of you have ever heard about flipping our lid or have used the analogy of your fist as your brain. But this is a really good time to think about how we flip our lid and what hormones have to do with that. This is directly related to our stress and how we handle stress. So if you think about your brain, this would be the prefrontal cortex. So this is the front of our brain, which we know is where we have all of our logical thinking, right? This is where a lot of that thinking happens logically. What we know is that at the center of our brain, so at the tip of your thumb inside of your brain, this is where a lot of those hormones are triggered. This is where the hormone says, release the hormone. Here we go. And this is where we have to really think about what is happening in adolescents' brains that would allow them to keep the prefrontal cortex in control versus flipping their lid, because this is activated. And so when we think about that, I have even had kids at school say to me, I'm here. Okay, they're understanding what is happening in their brain. They're understanding that right now, they're not logically thinking about what is happening. They're being triggered by all the hormones, which is thus causing their lid to flip. And so being able to talk to kids about what do we need to do to keep this prefrontal cortex in control versus our hormonal release, or what do we need to do in order to keep the good hormones at a consistent level and reduce the bad hormones. I don't like to call them bad because they all have a purpose, right? But sometimes those get out of control. And so we'll just call them out of control hormones. And so being able to say to kiddos, okay, what is happening in your body right now is going to be really important when we talk about stress and we talk about all of the effects of stress. So now we know a little bit about the hormonal connection to our body's reaction to things. Let's now apply that to stress and really looking at what is stress and how is it that our body is reacting, or what causes our body to react certain ways. We're going to look at the psychological aspects of stress now. And this is really important because we don't always know what the psychological symptoms of stress can be, but sometimes we can see it before we know what's happening. And some of the ways that we see the psychological symptoms of stress is we start to see that decrease in concentration and memory. We start to see that their minds are racing or going blank. You might even see it so clearly that you can see it pass over a teenager or an adolescent, or for that matter, any person. And what is happening sometimes in that mental block or that mental confusion is that those hormones are starting to take over. That's when we see when we're starting to be controlled in our brain by the hormonal or what's going on in the mental. What happens is your body is being told by all of these hormones that something bad is happening right now. Something is causing that stress to happen. And so our brain starts to shut down this part of our brain because this part is taking over. And these are some of the symptoms of that happening. We also see a lot of emotional reaction to different levels of stress. So we know that we see a lot of anxiety, right? Anxiety is that body's way of doing that fight, flight, or freeze response. And those are directly related to how many hormones are being turned on in our brain. We see a lot of anger, frustration, being irritable or impatient, feeling like we have a short temper. All of those could be symptoms of stress, symptoms of our body being a little bit out of chemistry, or possibly that we need to feel a little bit out of the ordinary because there is a level of stress present. And we're going to talk about that in a little bit, about good, or I hate the word bad, but good or bad levels of stress. And then behaviorally, we see a lot of movement usually. It's really hard to sit real still unless the hormonal floodgates open. And sometimes that's when we see that freeze reaction to stress. But typically we start to see the fight or flight response. And so we have this behavioral symptom of stress, which could be pacing, fidgeting, tapping our fingers, snapping pins, eating can be a component of that as well. We also see when behaviors such as drugs or alcohol start to play a factor, because drugs and alcohol directly affect our hormones. And so what happens is we sometimes become dependent on those to help us with those feelings if we don't know other ways to do it. We see a lot of emotional reactions. So we talked a little bit earlier about that anxiety and nervousness. That could come out as the behavior of crying or yelling or throwing things or hitting. When you think about adding the hormone adrenaline and cortisol and testosterone and a very stressful moment in a life of a child, we're kind of like setting them up as a time bomb, really, because all of that is happening inside their body, and we're going to start to see that coming out in different ways. And if aggression is one of those ways, that might mean that you're going to start to see a lot of throwing things, hitting, some more aggressive behavior. Voices rising, so we might hear yelling. So we'll see a little bit more of that aggressive side to the behavior. Now, I think it's really important to mention here that this does not always happen to just males or females. We always think of, or a lot of times we might have this vision of a female being maybe crying a lot and being very emotional, and seeing more males with fighting or hitting things. And that's not always the case. Males and females both have the testosterone and the estrogen hormone in them. So we also see females who might become aggressive, and we might see males who cry more or feel sad more. So it's not always a male-female definition. It's for all adolescents. And it's really important to remember that when we start to see the differences show up. I recently had a male whose mother sent him to me for therapy because she was concerned about him crying. And what I learned shortly after starting to see him was that he was crying very appropriately to the situation. But she was uncomfortable with that display of emotion. She was more in tune. If he had been fighting, I don't think she would have been as concerned. So it's really important to understand the hormonal aspects of the behavior that we're starting to see. All right, and then we have this environmental aspect of stress. So not only do we have all this stuff going on in our bodies, but we have a lot of environmental aspects that contribute to stress. And so some of them can be as simple as where we are, the room in which we are sitting in. If it has a lot of clutter in the room, it can induce these emotions of being overwhelmed and feeling anxiety. Sometimes when I go into classrooms, I become overly stimulated by the amount of stuff in a classroom. And what we have to remember are neat spaces really can help sit us in a better place. So for all of you school counselors out there, it's really good to think about, where do kids meet you? Where do you see the most anxiety? When are you starting to see these times when kids are feeling so overwhelmed? Typically, I always leave the big lights off in my office, and I only have lamps on. And what do we know that that does? It immediately induces different hormones to be activated. We want to have those feelings of calm around our children, especially in times of high testosterone or high estrogen levels. Being able to have a quiet place to go. Those are all aspects of stress that we can help environmentally. Sensory feelings, we've talked a little bit about. So harsh lighting, loud noises might cause anxiety or agitation. And so we want to feel inspired, but yet evoke some calmness about us as well. Being surrounded by familiar things. So when kids are going through tough stuff, we might want to give them things that make them feel safe, things that are familiar to them. So my daughter, who when she was going through puberty, all of a sudden became very attached to me. She wanted me to go to school with her. She would cry when she had to leave me. There was a lot of stress around our separation. And so what we did is we gave her something to carry in her pocket that she could reach in and feel, that reminded her of me. And so it was a very comforting thing for her to have that with her. And so that familiar object would increase her sense of connection to me and directly help her reset her hormonal balance in her body by moving to a safer place. So having some of those familiar things around is an environmental aspect of stress. What do we do with kids who are in trouble or who have to be removed from their homes? Typically, we take away all things familiar to them. And so what we know is that is going to cause a level of stress on its own. And so the more things that we can give them that feel familiar, and sometimes that's even just seeing a teacher or a counselor or a case manager that they know, those are the familiar things to them. And so being allowed to give them that will help them through those steps along the way. People. So people can cause indirect or direct stress to a person. So sharing a place or sharing things with someone you trust is going to be really important. And when people are present that someone doesn't trust, we have to know that that hormone is being turned on because it's activating that fight, flight, or freeze response. Teaching kids when they're getting ready to go to court how that feels is really important, because we know that when they go to court, sometimes they're seeing people that they don't trust. They might also be feeling or seeing people that they don't know. So police officers, judges, attorneys, all can provoke some feelings of distrust. And so it's really important to talk to kids about that and what that might mean when they go into court and how to address those feelings. And then culture. It is very important that we recognize the influence of culture and our beliefs and what that might mean to a person. I know in therapy, I talk to people a lot about their spiritual or their connection to religion, or their beliefs around traditions, because those may provoke some feelings or hormonal changes about if I'm safe or not. People may have suffered from religious trauma. And so the sign of a cross somewhere may start some of that hormonal changes and evoke some stress. Feelings of traditions being taken away from people might cause someone to feel lonely or may cause feelings of stress. I'll never forget my freshman year of high school. My family had moved out of state to Utah. And so I was away from all of my family members except for my mother and my brothers at Christmas. And I had never felt that before. And so what happened was I had this longing and this feeling of loneliness and sadness. And it was attached to the loss of a tradition. And being able to talk about that now, I totally understand it better instead of feeling like something was wrong with me, right? But those feelings of sadness made sense because I was outside of my culture at that traditional time of the year, and that brought along a lot of feelings attached to it. So environmental aspects of stress play a big role. And we have to start to see what are those environmental aspects and how can we control them or possibly change them. Which brings us to good stress. So according to the APA definition, good stress is the positive stress response involving optimal levels of stimulation. The key word there is optimal, the optimal level of stimulation. And so, in other words, it is a stress that might arise from doing something demanding, but still enjoyable. All right, so let's think of some good stress. I'll use this as example. I was a little bit stressed about presenting today and making sure that I had all of the stuff in my PowerPoint to present to you guys today. It was short term. I knew that after today, this presentation would be over and everything would be okay. So it keeps that stress level manageable. It made me focus my energy on getting the PowerPoint done, thinking about how and what I wanted to present to you today. And so it made me focus my energy, motivated me, inspired me to get this done. If it weren't for stress, I probably wouldn't be sitting here very confident. I would probably be not wanting to talk anymore, trying to figure out how to get this done, right? I would be going through all of that. But instead, a good amount of stress allowed me the urging or the push to get this presentation done. Good stress can be very individually measured. So for people who don't like to present, this may not have been a good stressor. I personally like to present. So this was a good stressor for me. And so all of that is a very individually measured, and it needs to be talked about individually so that you're always aware of what is a good stress for someone, what is a bad stress for someone. Again, there's that word bad that I don't like to say very often, but here we have it. Bad stress. Okay, so according to the APA definition, it's another word for bad stress is distress. distress, which is the negative stress response, often involving a negative affect and physiological reaction. It's a type of stress that results from being overwhelmed by the demands, the losses, or perceived threats. So typically a bad stressor is going to leave you feeling something. It's going to cause a lot of hormones to go on being too activated, okay? So it's going to maybe leave you jittery. When we get too much of those hormones, it starts to affect our body. We talked about that a little bit before, where we have this behavioral aspect that goes with stress. It'll wear you out, and it can also flood you. So if you think about the shower hormone being on so much that your body becomes flooded with those hormones, and what happens is it will decrease everything that we're doing. It starts to shut our bodies down because our body knows that that's too much of those hormones. And the only way it knows to do anything about it is to shut us down. Now, this will occur when we flip our lid and it stays flipped for too long. Many people will flip for a minute, but then they start to get it back under control. Some people may flip their lid and it doesn't get back into control very quickly. And so that's when we start to see that flooding happen. The shower has been turned on too long and it starts to cause damage. And so we know that that can lead us to anxiety as well. Really quickly, I know we're running a little bit over. I apologize. I know we were a little bit late in getting started. We do assessments to really look at the amount of stress that a person goes through. We use the ACE score. We do not usually give that ACE score to children under 12. And there's a specific ACE score that we use for teenagers. And so that is, and I don't think that's going to show up there, but it's called the adverse childhood experiences that you have over the period, or it's experiences that happen under the age of 18. So that's just something that we look for a guideline to go over with kids who are not 18 yet. So this would just be something that we use in our own minds to kind of designate how much stress they have had. The GAD score is an actual scoring card that we use that can determine the amount of stress that a child might be under at any given time. All right, so I know that's a lot of information, and so I want to open this back up to Stephanie. I think that she has a question that she's going to give out to those of you that can stay to kind of break out or to talk about a little bit more. But today, again, we were able to discuss what hormone contributes to stress. We were able to define stress, both good and bad, and discuss how it is a part of our everyday life, especially for teenagers who are going through so many changes. And we discussed the different ways that stress can affect our body. Now, in May, we're going to talk about what can we do about it and how do we help teenagers control that a little bit more. So thank you very much. I'm going to turn this back over to Stephanie and we'll go from there.
All right, thank you, Angie. So I do have a question for you guys, and then I'll put you into breakout rooms where you can take a moment, bathroom break, grab your coffee, your caffeine, something to eat, and then in small groups, you're going to discuss what ways do you use to help kids handle stress? And with the given information you heard today, how might your approach to helping kids handle stress look differently going forward? And I'm going to post that in the chat so that you can see that. And then I'm going to go ahead and put everybody in breakout rooms. I will also go back into the breakout rooms and make sure that there's not just one person in a room. All right, so I went ahead and closed the breakout rooms. I hope you did have some time to have a bit of a discussion. We have dropped down a bit, which is what happens at lunchtime, unfortunately. But Angie is going to go ahead and finish up and wrap up with the discussion and go over your questions.
Yeah,
You can also put
so
questions in the chat.
yeah, absolutely. So I just wondered if anyone had any discussion about how their approaches might be different, knowing this information now.
Anybody have any thoughts?
It's kind of one of those tough things to think about in the moment. A lot of times we know all of that stuff is going on, but getting a reminder of how it will affect kids and what that might do to help kids understand that a little bit more, hopefully has been something that you've enjoyed learning today. I am really looking forward to coming back in May and talking a little bit more about different things that we can do, different ways that we can look at it and maybe help kids with stress, and just being able to help a kid or any person really identify what's going on in their body is going to be really helpful. So I have my contact information, and let me just put that in the chat box if anyone wants to reach out to me. This is my email address, and Stephanie or Sierra will also have it. So feel free to contact me if you have any questions or anything that you would like to have me put into our presentation in May, and I'd be glad to get that done for everyone. So otherwise, thank you very much for having me here today, and I look forward to seeing everyone in May.
And we'll send out all of the contact information and the recording once it's been fixed and edited for delivery. Anybody have any questions for me or any needs from me? You can throw those in the chat as well. Otherwise, I hope everyone has a wonderful day.
Yes, enjoy your day, everyone. It's beautiful in Missouri, so I hope it's the same where you are. Thanks a
It was
lot for
raining last
having
time
me.
I looked.
Oh no, the sun is shining beautifully here, so I'm gonna go take a little bit of a walk. So, all right, and thanks everyone. I'll see you in May.